on Twitter. Washington Journal continues.
Jayne O'Donnell is consumer reporter for USA Today, here to talk about the health care law and the impact it's having on medical costs. Jayne O'Donnell, I just want to begin with your most recent story here with the headline from USA Today: medical debt will persist despite the health law. Why is that?
Well, because it'll be a smaller amount. I mean, the main thing that the Affordable Care Act prevents really is these enormous, some people have million-dollar debt. They're going into bankruptcy because they have hundreds and thousands of dollars in debt because their plans were capped. They would only go up to a certain amount. So now it's kind of reversed, where the Affordable Care Act caps what any individual family will have to pay. So it'll be a smaller amount, but some of these deductibles are just so large that the average family, if they do get sick and do have to pay for their health care, perhaps $5,000 or even more out of pocket if the prescription drug has there's often separate deductibles for prescription drugs. So it could be close to $10,000 you end up paying out of pocket if you have the unfortunate situation where, God forbid, you get sick, and that's why you have health insurance.
So before your insurance under the Affordable Care Act kicks in, you've got to pay premiums.
Yeah, we didn't even get to that.
Premiums, deductibles in the thousands.
Yeah, right. You've got your premiums, which in many cases are quite high, as they have always been for individual insurance. But these deductibles are really high. I mean, you and I have, presumably, I know I do, have employer-provided insurance. The average deductibles in employer-provided insurance are about $1,000. The average deductibles we found were about $3,000 to $5,000. We were just analyzing the healthcare.gov, so the 34 states that are using the federal marketplace. So that's pretty high for most people.
So how does that compare to what we've seen before the Affordable Care Act, when people went into debt because of medical expenses? Some, major surgery where they didn't have insurance and it cost a lot of money.
That's right. It could cost, and we all know, and one of the reasons, frankly, for the law is that it's trying to bring down health care costs. So, and as most people have by now heard, one of the reasons we're paying so much for, an X-ray or for an aspirin or an injection of something at an emergency room is because they're having to treat so many people who don't have insurance. So hopefully that it's going to bring some health care costs down. But if you get in a car accident, or if you got into a car accident, like I mentioned before, it could be tens, hundreds of thousands of dollars. Now, if an individual will be capped at $6,350, that's the most they'll have to pay out of pocket before insurance kicks in. For families, it's about $12,000. So a lot of money, but still good, still better.
Can you lower your out-of-pocket costs depending on which plan you pick?
Yes.
People are familiar.
Right.
You can, if you sign up for the Affordable Care Act for healthcare.gov on the federal exchanges, there's the bronze, silver, gold, platinum plan. Right. So can you lower your out-of-pocket expenses by picking a cheaper plan?
Yes, but the problem is, of course, that the people that have the least money to spend are the ones that are going to buy the bronze plans. Those are the ones with the highest deductibles. So yes, they're saving in premiums, but if they get sick, they're going to pay 60% of their out-of-pocket. They're going to pay 60% of the cost of all their health care needs. If somebody so it goes 60, I believe it's 60, 70, 80, and 90. So if you can afford, if you're presumably fairly wealthy, if you can afford a platinum plan, you're golden. You're really only going to pay 10% of what you're out of pocket. But the people that buy a bronze plan, 40% of what's incurred is going to be out of their own pockets.
And in dollar amounts, we were just showing our viewers healthcare.gov average insurance deductibles. So the bronze plan, like you were saying, for an individual, a $5,000 deductible. For a family, a little over $10,000. And then you've got silver coming in at about $3,000 for an individual, a little over $6,000 for a family if you sign up for the silver plan. Gold, $1,200 for an individual, $2,800 for a family, and then that platinum plan, $339 deductible for an individual, $683 for a family. What does that tell you?
It's a lot of money. We should mention that if you're one of the people who are I was going to use the word lucky, so perhaps it's not lucky, if you're one of the people who has a subsidized plan, so if you make up to 400 times the federal poverty level, which can be as much as $80,000, $90,000 for a family, which doesn't go far in a lot of places like where we live, But so if you're one of those people, your out-of-pocket is going to be adjusted downward. But if you're someone who's a decidedly middle-class family making about $50,000, $60,000 a year, an individual making $50,000 or $60,000 a year, you're not getting a subsidized plan, and all in you're going to pay in full. So it's a lot of money.
How do you judge affordability?
Well, we, you know, and that was one of the problems we had. You know, we hear from a lot of people. People write in. We ask for people to write in at healthinsurance@usatoday.com. But you know, this is such a politically charged issue that you don't want to believe, you know, if somebody says it's not affordable. I mean, I don't want to be the one. I mean, my colleagues and I don't want to be the one to say whether it's affordable, but the government has an affordability test. And they say if it's somewhere between 8% and 9%, if the premiums come to more than 8 or 9% of what your annual take-home pay is, it's considered unaffordable, and you don't have to even buy insurance. So that's what we looked at when we looked at, for another story, we looked at affordability. And it really, there were so many plans that even the government wouldn't consider affordable. I mean, I believe it was for a couple, making, I believe it's $40,000 to $50,000 a year, about half the counties didn't have a plan that would be considered affordable. I mean, that's a lot.
So what does the Affordable Care Act say about that then? Because here's your story. Lack aid, many counties have only pricey plans.
Right. Well, what the administration says, and of course there's, I don't have a position on this, and of course there's some very good validity to their what they say, or what some of the groups like Families USA says, is that this was designed to make insurance affordable for the people who were uninsured, not necessarily the people who had a private plan and then you know, needed to stay insured. So the goal is, of course, to get the uninsured insured. So those are the people that have subsidized plans. Those are the people who are happy. And I hear from them occasionally, and some of them are paying $50 a month, $100 a month in premiums, and no out-of-pocket or no deductible. So they're thrilled. It's just, and you know, maybe the journalists, we look at the negative sometimes, but you know, you respond to readers, you look at this, and you know, people were just jarred by what the prices were. And you know, I have to say, some of the people I know in this town that were some of the strong advocates of the law were the ones saying to me, once, you know, when everything got kicked off, or didn't get kicked off, October 1st, and there were so many problems, people were saying, wait, they would say to me just quietly, they said, you know, wait till people really can get on this site. The other shoe's going to drop, and people are going to say, my God, these plans are expensive. You know, it took a little while.
According to USA Today's analysis, here are the 5 largest counties where plans may be unaffordable. Philadelphia County in Pennsylvania, $475 is the minimum. $475 is the minimum premium. $444 in Orange County, Florida. $477 in Franklin County, Ohio. $447 in Mecklenburg County, North Carolina, and in Milwaukee County up in Wisconsin, $487 is the minimum premium. We're talking with Jayne O'Donnell. She's a consumer reporter for USA Today. Rose in Tennessee, Democratic caller, you're up first. Hi, Rose.
Good morning.
Morning.
Basically, I want to know, when you mentioned that bronze plan with the, you know, as high as that $10,000 deductible for a family, isn't that $10,000 deductible still, I mean, it sounds like a lot, but it's still a lot less than having to pay the full cost if you didn't have insurance at all, isn't it?
Sure. Oh, yes. Yes, definitely. But many people often weren't even paying for their insurance because it was paying for their health care because they couldn't afford it, and that's where they were ending up in medical debt or in bankruptcy, as I mentioned in the first article we talked about. So, you know, decidedly, it's better. Things are definitely better than it was. I was just making the point in these stories that problems are persisting for a lot of people.
Rose, you still there?
Yes, I'm still here.
Do you have a follow-up?
Yeah, well, also, part of the reason that healthcare costs are so high is because we've had to spend decades with taxpayers paying for uncompensated care for all those people who didn't have insurance. So the
exactly.
sticker shock.
Yep.
Go ahead.
No, I know exactly. I'm sorry. Go ahead. I was interrupting.
Oh, that's all right. So on her point, though,
yes.
that taxpayers have had to pay for those that don't have insurance.
Right, and that's the discussion I get into. You know, I have dinner with friends, talking to friends, and they say, well, why do we have to pay for those people that are poor or whatever they can? I say, well, you already are. I mean, that's the point. I mean, you are paying when you go to the emergency room or you go to the doctor, and things cost so much. That's why hospital bills are over the roof, because just so many people are not able to pay for their health care, and the emergency rooms have to take anybody.
Will the tab be less for the consumer under the Affordable Care Act?
Well, you know, down the road when we go to the hospitals, I mean, one hopes so. I mean, that's the goal here, but, you know, there's some skepticism about that in people I talk to. Monica
tweets in this: health insurance covers serious illness. It's time to avoid running to the doctor for colds, etc.
And that's the goal here with this. That's another one of the goals for the law, and I tell people that too. And you know, we thought about that a lot in my family. One thing that happens when you only have to pay $20 out of pocket, if that's affordable, which most families it would be, is you do go if you just think there might be, even flus. People were going to the emergency rooms for flus, or people were going to doctors. But a lot of this stuff can be treated at home, and that's the goal, to get people to really think about why they need to go to the doctor. The problem, of course, is they're sometimes not going to go till the last minute, and then the cost is going to be, astronomical.
White Plains, New York, Democratic caller. Hi, Michael.
I'm there. Are you there?
Yes, we're listening, Michael. Go ahead.
What I want to say is, we need a national health plan like they have in Canada. Anyone who has the money and can afford it should be able to buy private health insurance if they want it. And the other option is doctors will be able to treat private as well as Medicare, and they will get a certain amount of salary pay like they do, and then they can have a certain amount of private patients. But unfortunately, now be funded by like a 5% national sales tax. The money will be going to fund about a 3%. I don't know, whatever the figure is.
All right, Michael. Jayne O'Donnell.
Well, what I would say is this is about as far as the administration was able to get. This is what the administration was able to get passed. Anything that goes any farther would remain in real question, I would think, because look at how many efforts are underway to undermine this, if not get it repealed altogether. So I think we have to pretty much be happy with what we have, and there's going to be tweaks around the edges, and hopefully the proponents say that'll be all there is.
Ted in Raymond, New Hampshire, independent caller.
Yes. Hello?
Hi, Ted. You're on the air.
Yes. My question is, she mentioned $6,000. I think that was for the most they could charge you. Is that per procedure? Say if you had to go 3 times in the year, or $6,000 every time, or is this capped at just this one-time charge of $6,000?
No, that would be the most you would pay out of pocket a year. So, I mean, if you had, as we mentioned, these days with the cost of health care, almost anything, certainly if you stayed overnight in the hospital, you'd probably hit $6,000. And then for the rest of the year, you would not have to pay more out of pocket. So yeah, you wouldn't have to worry about it being $18,000 if you had to go to the hospital 3 times.
Does that differ in which plan you choose?
No, the government, that's what the government says is the cap. Actually, I should say, yeah, it could be lower. Yes, depending on what plan you have, it could be lower. That's the maximum, though.
Maximum.
And that's a thing to look as you're shopping. If you don't have insurance yet, when you're looking at the plans, the maximum out of pocket is one of the things you have to look at, along with the deductible and the premium.
How do you tell people to shop among the plans, the bronze, gold, platinum, silver?
Well, you can't. I guess you can't say it anymore. But we were saying take your time. And of course, anyway, people did end up having a lot more time than they realized because it was so hard to get on. But really, just to I actually have recommended to people navigators or insurance brokers, because it really is so complicated, and like as has been talked about before, that it really isn't as easy as buying an airline ticket on Orbit. So you really do need to really know something about it, and it's really important, I think, to sit down with somebody who could help you understand what you are likely to pay, and to balance out. If you are somebody who takes a number of prescription drugs, it may well make more sense to pay a higher premium a month, just because, particularly if there's a separate deductible for prescription drugs. I mean, it's really jarring. I mean, even group insurance now, sometimes people are having to pay, you know, $100 here, $100 there every time they get a drug until it hits $3,000 or $5,000.
You could talk a little bit more about the separate deductible for pharmaceuticals.
So it's becoming, you know, it's fairly common, or it's becoming more common, I should say. And there's a chance that, or at least the group insurance, employer-provided insurance, for another year will be able to do that if they want. If there's an outside company managing the pharmacy benefit, they can charge a separate deductible for that. And I know plenty of companies that have done that, and people aren't happy.
John, in Florida, Republican caller.
Yes, good morning. Given all the downside we hear about the program, one small example, like young people are not going to be buying into this, how long do you project it will be before the roof caves in?
Oh, I'm not going to make any projections, and I don't know that the roof is going to cave in. I mean, that's certainly something that everybody, the Republicans, would say is going to happen fairly soon. But it's really hard to say, and I do want to mention that you know, in some of our earliest stories, we've been analyzing the data on healthcare.gov since early November. And one of the things we noticed is that some of the plans in some counties, I mean, there's just such a wide range. I mean, it's literally all over the map. You know, and it's not just, there are exceptions that would surprise you in both directions. So the insurers were being pretty cautious. Insurers were very nervous. They don't know what they were getting. Like the caller mentions, they didn't know how many young people they were going to get, and you know, the evidence now suggests they aren't getting as many as they need. So that's worrisome when you look at some of the stuff I've reported on, and that the premiums and the deductibles can be so high in certain parts of the country. It could get worse. I mean, the hope is it's going to get better, and that when they really understand who their customers are, they didn't know who their customers were, so they estimated up supposedly. So maybe it'll get better. Let's do glass half full. How about that?
What are you hearing about costs now that people can start using these plans starting January 1st? People who bought into the federal exchanges could start using these different plans. Right. What are you hearing?
Well, I have not talked to anyone yet that's used a plan. I mean, so many people haven't even gotten their cards yet, and there's that kind of thing. So I honestly don't know what the actual costs are, and I doubt there's much of a change. I mean, if anything, it's just going to continue. You know, as most people have reported by now, you know, healthcare costs are growing they're growing, but at a much slower rate than they were.
We're talking with Jayne O'Donnell. She's a consumer reporter with USA Today about healthcare, the healthcare law, and the impact it's having on medical costs. George in Bradford, Ohio, Democratic caller.
Hey, yeah, I think it's more insurance companies trying to rip people off than anything.
Why do you say that, George?
Because you figure, well, Obama said at the beginning, you can keep your insurance if you want. Well, I don't see why insurance companies would be dropping people when they now know that they can get more people to come into the firm.
Well, I don't know that insurance companies are dropping people. What they did was, if the person had a plan that didn't meet the criteria of the Affordable Care Act, they put them into another plan. Now, one of the problems was that many, perhaps most of those people ended up in a much more expensive plan because it had to cover a lot more. And you know, if you were a woman of childbearing age, you might have been happy because it would cover maternity care. But if you were a 60-year-old couple, and I've heard from several of these, you know, they weren't happy that they had to do that. So the insurance companies are still trying to make money. I don't know if I would agree with the caller, but they're, as I mentioned, being cautious, and they're waiting to see how this shakes out and how hard of a hit that they're going to take from having to meet all these new provisions.
On our line for Republicans, Walter in Washington, North Carolina. Hi, Walter.
Hi. I was calling with a story about what happened to the impact of this act here in North Carolina. 3 months ago, when they tried to implement the Affordable Care Act into the computer systems at HHS, and this was testified to in front of our state legislature last week, it crashed our food stamp system. The entire state of North Carolina has been without food stamps or EBT cards since November.
Boy, I had not heard that. That's certainly a shame. We've heard, you know, that's perhaps one of the most drastic things I've heard, other than outside of just problems happening, you know, here where we're located. Maryland has continued to have a lot of problems with their exchange. They did their own. They have their own exchange, and it was considered quite competitive and a good exchange, but they're having a lot of problems too. So a lot of these problems do continue. I hope in the situation in North Carolina it was at least rectified fairly quickly.
How are on this question of affordability, because you looked at the federal exchange.
Yes.
Compare that though to state exchanges. Affordability, is it better if their state set up their own, or is it worse than the federal exchange?
That's so time consuming, but a company called Avalier, it's a consulting firm, they did an analysis, and we had them look at what we did, just help us kind of make sense of what we were seeing, because their average deductible was a little lower because they did average in, they did just kind of a scattershot survey of state and the federal exchange, state exchanges and those that are using the federal exchange, and their average deductible was more like $4,000. I mean, still really high though, so it's good. It really just depends how many, I mean, generally speaking, they're better off because the insurance companies felt comfortable going into the state, because the state said early on, we're going to do this. Some of the insurance companies, they were just like, hey, we're going to wait and see, because this state is saying yes, they're saying no, we don't know what's going to happen. So, you know, a lot of the big insurance companies ended up pulling out of different states, or a lot of those stories over the summer. So it pretty much depended on what the presence was. And I would like to mention, like in the state of Virginia where I live, it's the federal exchange, and you might think that it would be the prices would be higher. It's actually a fairly competitive state, and it was interesting to me to learn that they had, part of it was because they had one or more insurance companies that were already doing business in the rural areas, and we didn't mention this, but the rural areas, you know, as before, are still the ones that are hardest hit. It's hard to find doctors, hard to find hospitals. Not many insurers want to have their plans there because they can't put together the networks. But Virginia is actually fairly competitive.
We'll go to Malik next in Arlington, Texas. Democratic caller.
Hi, how you doing?
Good morning.
Hi, how you doing?
Good.
I actually have a plan. I bought a Blue Advantage Silver Plan PPO from Blue Cross Blue Shield.
Where do you live?
I live in Arlington, Texas.
Uh-huh.
And my plan is $370 a month, and that's with dental. And it's much better than what my employer had given me at first. I was paying almost $200 a month for an employer plan that really didn't cover anything. And it had like 47 things that they didn't cover. In fact, they wouldn't even cover routine foot care. And I work at a chemical plant, and I'm on my feet all day. And I'm not subsidized because I make too much money to be subsidized. But this program, if it wasn't in place, I wouldn't be allowed to have this insurance because I had a pre-existing condition. So now that although I'm spending a little bit more money each month, the care that I'm getting is much better. I can see a much more ranged network of doctors, and even my medication is covered. Under my employer plan, they only cover generic medicine, which everyone is covered generic medicine. But so people who don't want this plan to be in place, they really need their head examined, because it's helping a lot of people just get routine health care. I don't know why anyone would want to stop someone from getting routine health care. I'm paying for it myself. I work hard. But I wouldn't be able to get Blue Cross Blue Shield if it wasn't for the mandates in this program that says you can't be denied for pre-existing conditions. And I don't look at this as government intrusion. It's more like a patient's bill of rights, because all the things that are in here only say you can't be dropped, you can't be denied coverage for pre-existing conditions, and some other things that are really helpful for people who just want to pay for insurance.
Okay. All right, caller. Jayne O'Donnell.
Yeah, and it's so nice to actually hear these stories like the caller has, because this is exactly what the law was really. This is one of the things the law was designed to address. And frankly, it's sad, but the number of people that I hear from, it's way weighted to the ones complaining, but the ones that have been the happiest, and I quoted them, I think actually in the most recent article, are the people that had pre-existing conditions and couldn't get insurance. And we didn't mention than that, but that's the biggest thing. I mean, they're probably the biggest thing, because again, like if people that have cancer or heart disease or these kinds of problems can't get insurance, we all are going to be paying for it anyway. So isn't it great that a gentleman like this could get affordable health care and have these things covered? And we also didn't mention that, yeah, while these different costs are going up, and while they are trying to get us to not go to the doctor every time we have a cold, they are going to pay for our physicals. Our physicals will be paid in full, our mammograms will be paid in full, colonoscopies, all these kinds of procedures that we used to have to pay a certain percentage out of pocket, or a copay will be covered.
Preventive care is free.
Yes.
Under the Affordable
Yes.
Care Act.
Yes.
How much do people think that would save in medical costs?
You know, I'm not actually sure. You mean out of pocket for the average person?
Yeah, or just in general, medical costs. If you catch something early enough, like breast cancer.
That could save, well, it depends on who you're talking about. If it's the federal government, it'll probably save billions. And that's the people that I've been talking to. I went to Philadelphia, was one of the first stories I worked on. And these people, some of these people that were very low income, had every possible problem you could imagine. And this one woman who I've become kind of friendly with, I mean, she's been in the hospital. I think I've talked to her, I've known her for 3 months. She has diabetes, heart disease, asthma, and a couple other things on 10 medications. Twice that I've called her, she has just gotten out of the hospital for a full week. And this was not being paid. She can't pay the bill. So these, they just have to, people like that just have to keep, saying, sorry to the bill collectors. So if she had been getting regular doctor visits and had affordable drugs and could go to the doctor and have these different things treated, she ends up having to just choose between which ailment she's going to address. It's very sad.
Is she going to get coverage under the Affordable Care Act?
Yes, and she works too. She works part-time, but not enough hours to get group insurance from the health clinic. Ironically, she works at a health clinic, but yeah, she's going to be able to get.
Which plan did she choose?
I don't remember the plan she chose. She hadn't chosen it yet when I talked to her, but I know it was going to. I recall it was going to be about $167 a month, and she was paying far more than that just out of pocket in drugs every month.
Bill, you're up next in Waycross, Georgia. Independent caller. Hi, Bill.
Hi. Good morning.
Morning.
Hi. My question is regarding, why do we still, in this country, pay 3 to 5 times as much for pharmaceuticals as anybody else in the industrialized world? And, to the argument that it's, they're American companies and we pay for R&D. The same thing happens with drugs that are made, marketed, and distributed out of Japan, for instance. And how much has your investigative reporting, do you look at the amount of lobbying money from the pharmacy companies and the insurance companies? And I'll take an answer off the air.
That's not something I personally have written on. I've covered Washington for quite a long time, and I'm aware that the pharmaceutical industry is one of the top industries. Remember, the former chairman of the Energy and Commerce Committee went on to head that association. But I will tell you, I think one of the things that I have covered over the years, I covered the Federal Trade Commission, and they've worked very hard on the kind of patent deals that often go on between the brand name drug companies and the generic companies. Sometimes the generic companies are getting paid off to stay off the market, and that's one of the things that leads to these high drug costs, that you end up paying for the name brand drug far longer than you would have otherwise. So that's one of the factors. I can't really address all the other factors because I haven't covered it.
Phil, in Oklahoma City, Republican. Hey. Hi, Phil. Hi. You're on the air. Go ahead.
Greta, one of the things I wanted to say about health insurance is that when you pick a plan, you want to pick one that your doctor's in the right network, because there's 15 different networks per plan. So very important you look at their network first and then pick a plan. The other thing is there's lots of people that are rejected for the health insurance, but they're really never given a reason. They don't get a letter. They don't tell them why they were rejected. And the Fair Credit Reporting Act requires people with turndowns to get a letter. Why can't we have a Fair Health Report Act? And what are the reasons for being rejected from health care? I mean, I've seen people with higher incomes that are rejected and people with lower incomes that are accepted. So it's not all income. It must be a lot of reasons why they're rejected.
Okay, Phil, we'll leave it there. Jayne O'Donnell.
Well, you back to the doctors. That's another thing I have reported on. In that, and one of the things. So this probably was mid-November when I was talking to doctors. At that point, and I know it's still the case. I've read this. Some of the doctors don't even know what plans they're on. So it's not. So if you know, one of the obvious things one tells people is, okay, well, call your doctor and make sure that he still accepts Blue Cross. Some of them don't even know. I mean, some of them, there were different rules for the different insurance companies. Some of them would automatically put the doctor in their exchange plan if they were already on their private insurance, regular non-exchange. But there was really no rhyme or reason, and because the system has been kind of screwed up, and the doctors haven't always heard about what plans they're accepting, it can be difficult. But it is a perfect point to be made that yes, you need to check, because a lot of times the provider networks really have been reduced, and I know there's been a lot of complaints, particularly in New Hampshire was one area where they were very unhappy that, you know, they have basically the people that were going to Boston to get what they considered the real quality care couldn't do that anymore. You know, as to why people are rejected, I hope that this law solves a lot of that, because there are so many more choices now that people are not going to have that problem, and they certainly can't be rejected because of pre-existing conditions as far as their credit. I'm not sure how that's going to be affected.
We have a few minutes left here with Jayne O'Donnell of USA Today. Matthew in Titusville, Pennsylvania, Republican caller.
How you guys doing? Yeah, my question is, the veterans that are going through the VA, how's that going to affect them? Are they going to keep their VA privileges, or is it just going to shut down? That's my question.
No, you're in good shape.
Veterans?
Yes, they're still fine. I mean, just as if you were on Medicare, you don't have to worry. The veterans can still do that. I mean, there's, you know, if there was some problem with your plan, you might, I suppose you could, I was told you could consider looking into something on the exchange, but you should be completely fine and unaffected by this.
Gloria, Indianapolis, Democratic caller.
Yeah, good morning.
Morning.
I'm confused about something that the guest said. Did you say that you have to pay sometime a $5,000 or $6,000 deductible before the insurance even kick in?
Yes, exactly.
Well, then that takes me to another confusion. If your out-of-pocket is a certain amount, you're saying that you have to pay the deductible, and then you pay an out-of-pocket. If you know, that seems. Who would go to a doctor, you know, under those conditions?
Well, you know, as I mentioned, the out-of-pocket limit, and when we think of out-of-pocket, think of that as everything you'd have to pay, which would include your deductible. So you wouldn't have to pay much once you'd hit your deductible. If you were just an individual, and with the limit of $6,350, you would only have to pay another $1,350. I didn't make the exact point early on that the reason that we say that the medical debt could persist is because the Kaiser Family Foundation, a very well-respected group, says that they did a study on medical debt, and they said the average family really only has $3,000 they could put their hands on. So even just getting up to the deductible is going to put people in debt. Is it going to send them to bankruptcy? Unlikely, but there's still going to be a fair amount of debt.
When you sign up for one of these plans, bronze, gold, whatever it is, when, as a consumer, are you opening up your wallet to pay for health care? At what points in the process?
Well, you're going to owe your premium pretty quick, and you're going to, as soon as
that's your monthly bill.
Yeah, your monthly bill is your premium, and then, you know, as soon as you go to the doctor, unless you have a platinum plan that doesn't even have co-pays, you're going to be paying a co-pay. If it's for a cold, you're going to be paying out of pocket. If it's for your physical, you're golden.
Then it's free.
Yeah.
And then deductibles, is that right? After that?
And then deductibles. You can go get as many colds, flus, strep tests, broken ankles, those things until your $3,000, $2,000, $5,000, whatever it is, dollar deductible is met. Then you'll be paying a percentage of the cost of your health care. If you have a bronze plan, it's going to cover 60%, and you're going to be covering 40% of your health care.
Let's go to Sonia next. Anaheim, California, Democratic caller. Hi there, Sonia, in California. You're up.
Thank you.
Okay,
Hello.
Go ahead. Hello.
Hi. Hello, my name is Sonia, and I live out here in California. And I've been trying to apply for the Affordable Care Act. the Affordable Care Act. I wait on the line. Then they recommend me to go to Medi-Cal once they hear how much I make a year. Then when I get to Medi-Cal, Medi-Cal tells me, oh, no, you got too much. You don't qualify. So I call back to the Affordable Care Act. They tell me, well, you see, you slipped in between the cracks, and you can't get health insurance from this way or that way. You would have to go to a clinic. So who do I believe?
That doesn't make sense to me because I believe California expanded Medicaid, so I don't understand. When you say you went to the Affordable Care Act, you mean you called the California Exchange, I believe it's called Covered California?
Exactly.
If I were you, Sonia, I'd be calling an insurance broker or a navigator. I don't have a personal, my personal view of this is strict. I would suggest finding an insurance broker. It's not going to cost you any more than the navigator, but find one that sells a number of different kinds of insurance. But the navigators are very good in California. That would work well too. Go on the federal website, healthcare.gov, and search for California and look for help. And it'll give you a list of organizations that can help you because you're being told the wrong thing, this idea that you would just have to go to a clinic. Everybody can get health insurance. It's just a matter of what price they pay.
All right, let's go to Carrie in Evans, Georgia, independent caller. Morning, Carrie.
Good morning. My question is that with the youth being a demographic that is entirely important to be getting on the ACH plan, with them still being able to be covered under their parents' plan, many even being married and still being able to be covered under their parents' plan. How are we going to stimulate the youth to be able to want to be a part of this program when they're already being covered under their parents' insurance? Twofold. Additionally, there seems to be many doctors that are opting out and not going to accept the ACH plan whatsoever.
Yeah, and that's a big concern. Obviously, that's a two-part question. It is a very big problem. They do have to get a lot more young people. There are like as you mentioned, there are a lot of young people that are still on their parents' plans, but they can only do that till they're 26. But there are a lot of people under 26. So you've got, I mean, there's stories locally on, you know, there are people that work for these navigator groups hanging outside of bars at 2 o'clock in the morning trying to interest people. And there's a lot of these kind of really extreme but pretty funny sometimes ads trying to remind people that young people that the kind of risks they take make them the perfect candidates for health insurance. So they really have to get them. That is the big challenge, and you hit the nail on the head there. The doctors, yeah, that's a big concern. I haven't personally looked into that much how much less the doctors are getting. I mean, I know doctors around here that are insulted by what Medicaid pays. They say, one doctor told me he'd prefer not to get paid. He'll still treat the patient, but he doesn't want what Medicaid pays, and some of these plans pay comparable amounts to Medicaid. So it is a big concern, and it's the reason, as the previous caller mentioned, you really have to check to make sure the doctor you want to go to or a doctor you want to go to is on the plan.
Eddie in Massachusetts, Republican caller. Hi, Eddie.
Good morning.
Morning.
I'm concerned about the industry itself. I recall decades ago, General Motors said that they pay more for health insurance than they do for steel. Now, with the highest corporate tax and with higher premiums, how are they going to compete in the future? Will their insurance rates go up? Thank you.
Yeah, probably the company's health rates are going to go up. As you probably know, the big companies got a 1-year delay before they actually have to cover everybody, but they will likely raise rates for people that are on their insurance, and you know, pretty much everybody that has employer-provided insurance knows that the deductibles, they have been going up, the premiums have been going up, and the number of options have been shrinking. So it's certainly going to hit. You know, you're still going to be better off if you have employer-provided insurance, but it's not going to be as good. So I think that's how they're going to compete.
We'll have our last call from Caroline in Florida, Democratic caller. Hi, Caroline.
Hello.
Good morning.
I appreciate your program. I just wanted to make a point about, I just recently got on Medicare, and I was on insurance through my company for many, many years, and the premiums on those policies went up every single year over the 28 years that I worked for that company. Originally, our insurance was free. Our employer paid for it. Then over the years, every year we paid more, we paid more, we paid more because they couldn't afford it. It's a small business, you understand. So at the end, our premiums were $380 a month for our insurance. This is private, group health insurance through a private company. So, I don't see where those premiums are that much higher. My coverage got less, and my deductible went up every year while my premiums were going up. My maximum out-of-pocket went up every year while my premiums were going up. So, like so many people have said, the problem is the cost of insurance and the insurance companies and what they're paying for insurance. And the other thing is I just recently had cancer for a second time, and, they wanted to give me this shot that they gave me the last time I had cancer, like at the very end, every week, and this shot cost $4,000. And of that $4,000, I'm on Medicare now, I had to pay $640. Now, that's the kind of thing we need to be looking at. Why do I need the shot every week this time when I had the exact same treatment before and they didn't give it to me until my blood counts were super low?
Again, that's a two-part question, and the caller makes a very good point, and I'm really glad that she brought it up because we didn't make the point, and there's so much criticism of this law that I think people do forget that insurance has been going up every year. And so when people get hit this year, they say, well, it's the Affordable Care Act. Well, it went up 5 years ago, and it wasn't the Affordable Care Act. It has been jarring for people. I agree, $380, or I should say, $380 sounded like a lot to you, or sounds like a lot to you, and sounds like a lot to a lot of us, perhaps. But I'm hearing $800 a month, $1,200 a month, people that are trying to buy individual insurance in Connecticut. I'm from Connecticut, and the rates are very high up there. So it certainly isn't just the Affordable Care Act that's making rates go up by any means. It's the cost of health care, and you have to be such an informed consumer, and you have to ask so many questions, and it sounds like the caller did ask her doctor about that, and I hope, because they often do ask for care, and now that we're all going to be paying more out of pocket, you have to really be a smart consumer.
On this issue of affordability, what are you watching for next?
Well, in the short term, we just want to continue to see as more data goes up on healthcare.gov. The data on the deductibles just went up last month, so perhaps there'll be even more information to analyze. Hopefully, we can take a look at some of the big states, but it's going to be really interesting to see what happens next year because, as we talked about, maybe it'll go down. Maybe the insurance companies overcompensated, for their fears about the unknown, about who they're going to be, who they'd be covering. Or maybe they're not going to get enough of the young people, as another caller mentioned, and rates will go even higher. So it'll be really interesting.
And is that key to affordability? Because James Ard tweets in, is it moral to ask young people to subsidize insurance for baby boomers who made bad decisions and became unhealthy? Does this affordability question all hinge on young people signing up?
Yeah, well, he raises a good point. I mean, I don't know the answer to that. And young people, they can get fairly good rates. I mean, they are subsidizing older people to a certain extent, but the rates are pretty good. I mean, every small business, I've been talking to small businesses and mid-sized businesses about what it's like for them, and they all need a lot of young people because to offset it, to subsidize it, but the rates are better for the younger people.
If you want to follow Jayne O'Donnell's reporting at USA Today, you can do so online at USA.com or on Twitter at Jayne O'Donnell. Thank you very much for talking to our viewers.
Thank you so much. My pleasure.
Coming up next, our weekly Your Money segment continues with a look at how your tax dollars are being spent to help Americans with their heating bills. But first, a news update from C-SPAN Radio.
It's 9:22 a.m. Eastern Time. Well, the United Nations Nuclear Agency is confirming that Iran has halted its most sensitive uranium enrichment work. That's part of a deal struck with world powers. A report by the International Atomic Energy Agency says Iran stopped its 20% uranium enrichment process, and that level of enrichment is just steps away from bomb-making capability. And an American missionary detained in North Korea was under guard today when he appeared before reporters to apologize for committing what he says are anti-government acts. Kenneth Bae also appealed to the U.S. government to do its best to secure his release. Mr. Bae was arrested in November of 2012 while leading a tour group. He was accused of crimes against the state and sentenced to 15 years of hard labor. And the opening of Postal Service retail centers in dozens of Staples stores around the country is being met with threats of protests and boycotts by the agency's unions. The new outlets are staffed by Staples employees, not postal workers. Postmaster General Patrick Donahoe says the program has nothing to do with privatization and everything to do with customer service and driving up demand for the agency's products. The union says it's not asking to shut down the program. It wants the counters to be run by postal employees, not workers hired by Staples. And those are some of the latest headlines on C-SPAN Radio.